Nearly 1 million Americans live with Parkinson's disease, which makes daily life unpredictable and very challenging to navigate. Dr. Stuart Isaacson is the director of the Parkinson's Disease and Movement Disorder Center, and he's here to share some good news. Good morning.
Good morning. Thanks for having me on to talk about Parkinson's disease and a new treatment option on behalf of Supernus.
Well, help us understand, if you can put it in a few words, what Parkinson's disease is and what those symptoms look like.
Well, as you point out, it's a very common problem. It's the second most common neurodegenerative disorder of aging. Happens to people in their 60s and 70s and 80s, but about 20% of people, it happens when they're in their 50s or even younger. We don't know what causes Parkinson's for most people. About 25% of people have a gene that causes Parkinson's, though. We don't have a cure yet. We're working on a lot of research trying to find a cure, and we think we're going to have a breakthrough in the next few years. But for now, we focus on treating the symptoms of movement problems and the non-movement problems of Parkinson's. That's really how we're trying to address it, because people with Parkinson's disease have it for decades, so we need to have better treatment options to treat people well so they can live their lives for decades.
Well, in the material you sent me, I was excited to read there is an FDA-approved new treatment. Tell us about that and how it works.
Well, initially, we tried to improve the chemical in the brain called dopamine. This brain chemical dopamine, when it's low, leads to movement problems, a shaking in the hand, we call tremor, slowness, stiffness, trouble with walking or balance, a lower voice. And we give medication to improve dopamine, and many people take pills that have L-dopa or levodopa in it that gets absorbed through the gut, gets to the bloodstream, the brain gets converted to dopamine, and improves symptoms so well. But after a few years, instead of having improvement and benefit all day long, many people recognize that they take a dose of this medication, they swallow the pill, and it may take 30 or 40 minutes to begin to work. And then the benefit and the symptoms only last a few hours. And they have to take higher doses and doses closer and closer together. And yet they still have these ups and downs, and it's very unpredictable when the medicine will begin to work, how quickly it'll work, how well it will work. Sometimes when it's working well, people have extra involuntary dyskinesia movements, and then the benefit's not there and they have to wait for the next dose, and winds up about half their day they're not having good benefit, and the other half a day they are. Anapco, this new medication that was recently approved by the FDA just a few weeks ago, has been available in Europe for over 30 years. And finally, we've been able to study it and get it approved here in the U.S. to help people living with Parkinson's. We studied it by having them use this Anapco and add it on to what they're already taking. And we found it to be effective, to be safe. Some people could have side effects like sleepiness or dizziness, nausea, skin problems, but most people demonstrate tolerability. And when it's added on, instead of half the day being good benefit, they wind up having 3/4 or more of the day being good benefit. So really, this could be a game changer for people who are living with the ups and downs, the unpredictability of taking medications, more and more medications. We have over 24 medicines, and now we have Anapco, a new treatment option. But it's not a pill. It's different. Anapco is a wearable device. In the morning, a person with Parkinson's puts it on, and it gives medication just beneath the skin, where it's absorbed in blood vessels beneath the skin directly into the bloodstream, into the brain, where it works just like dopamine to improve symptoms. But because it's going evenly, continuously beneath the skin all waking day, it improves the symptoms continuously. Not these ups and downs, but more even. So we found that people can have benefit continuously throughout the day and have more predictability, be able to schedule their days, go to work and actually work continuously, go to exercise, see family, go to meetings, and not have to never really know when they're going to have symptom benefit and when they're going to have trouble moving. With the Anapco added on to what they're already taking, to get more even benefit and can really get on with their day.
Very exciting news. Send our viewers to a website where they can learn more, please.
Sure. They should talk, if they're having these symptoms, these ups and downs, talk to your doctors and nurses, keep track of the symptoms when they're good times and bad times. There's a website that has some of these tools to track symptoms about Parkinson's and also about the new medication, Anapgo. The website's called anapgo.com, ONAPGO, anapgo.com. A lot of information there that they can discuss with their doctors and nurses.
Thank you so much, Dr. Isaacson.
Great. Have a great day.
And we'll be back with more local lifestyles right after this. Stay with us.